Grammaticus there in Brussels. Now, more than 2 hours are wasted per day in every NHS operating theatre because of inefficiencies. Now, that's the finding of analysis by One Health watchdog. NHS Improvement looked at more than 1.5 million routine surgical procedures carried out in England last year and found that those hospitals could do 280,000 more non-emergency operations a year with better organisation of operating theatre schedules. On average, 140 minutes a day was lost due to delays, late starts and early finishes. Our health editor Hugh Pym has more.
Judy knows all about the pain and distress of a last-minute cancelled operation. She spent the night in hospital without eating in preparation for surgery. But after waiting the whole of the next day, she was sent home and told she'd be given another date.
I was angry that I'd not been kept informed. I felt disempowered because there was nothing I could do about it. And I was also aware that because of the condition I have, I am very restricted now in what I can do until I have that surgery. So I knew that my life was going to go back on hold.
But today, Judy and many other patients waiting have discovered that the NHS could be doing a lot more operations. Better planning, says the health regulator, would mean more patients being treated. And here's an example of what can be done. Thanks to changes proposed by surgeons and other staff, Croydon University Hospital increased the number of cases seen in operating theatres by 1,200 in a year. The secret, they claim, is simple.
We're working and starting sharply on time first thing in the morning by changing the way that we schedule our lunch breaks, by ensuring that we finish at the end of the day and overrun if we need to. We're able to manage that extra patient on a list and fully utilise that list rather than letting it lie fallow. And that's made a huge difference to the number of patients we've been able to get through our theatre doors.
Hi Rupert, hi, I'm Selsa. I'm just going to come and do your pre-assessment.
Making sure patients are fully prepared for their surgery is a priority. They see a consultant and then have their medical checks all on the same day. Croydon's reduced the number of cancelled operations by nearly half.
We've had the patients being cancelled on the day, so on the day cancellations, because we are not sort of medically fit and we still need to do more tests on them because they were pre-assessed just too close to the operation date. So now what we're doing is we are assessing them much more earlier, so then we pick up all the medical problems.
There's a big debate going on across the NHS. It has been argued that it could make better use of resources, including operating theatres. But there have been many demands for more money to keep up with rising patient demand. Senior surgeons say the real problem is making sure there are beds for patients after they've had their operations.
There's this constant backlog all the way through so that the new patient cannot get into hospital because the last patient is still in the intensive care unit and as yet cannot get back to the ward because the ward patient cannot go home.
Croydon has shown that more operations can be done, but it's not clear whether other hospitals can follow or whether there are deeper-rooted problems. Hugh Pym, BBC News.
It is 14 minutes past 6, our top story this evening.